Sexual health and safety. Sex and the law. In terms of age of consent, in Australia, New South Wales, Queensland, ACT, Northern Territory, Western Australia and Victoria all have 16 years of age for the age of consent, while South Australia and Tasmania has 17. It is an offence for a person in a supervisory role to sexually engage with a person under their special care. This includes a teacher, foster parent, religious official or spiritual leader, a medical practitioner, an employer of the child, or a custodial officer. Basically, anyone who holds influence or power over the child. But what if both parties are under the age of consent? Sexual exploration between two parties that are equally consenting and of a similar age is often a normal part of growth and development. Sexual interaction that is harmful and abusive between two young people under their legal age can be difficult to identify and determine. In situations where there is a clear age difference, for example, a teenager and a young child, any sexual interaction is sexual abuse, as there is a definite power imbalance. However, when both parties are close in age, identifying whether their sexual activity is abusive or not can be much more complex. There are four areas that need to be present in order to give consent when it comes to sex. The first one is understanding what the physical act involves. The second is the meaning of the act. The third is the society's laws and cultural norms. And the fourth is possible consequences of the act. Sexual consent has been modernized with new laws taking into consideration digital technologies. Sexting laws provide a good example of how digital sexual activity does not necessarily align with the broader age of consent laws in Australia. Looking at STIs now. Here we're looking at sexually transmitted infections, commonly referred to as STIs. We're going to segregate it into three main areas. So we're looking at them in terms of bacteria, viruses, and parasites. Looking first at parasites. So these are common ones. It says pubic lice or crabs, little crabby there. Or you can also have scabies as well as a STI. Viruses is the next category that we're going to look at. One of the common viruses is the human papilloma virus, which now, thanks to amazing scientific work, there's vaccinations. We're vaccinating both women, we're vaccinating young girls and young boys. For those of you Australian, that's part of the immunisation package that we do perform under the government initiative in schools. The big thing with human papilloma virus is another name for it is genital warts, and it is associated with the cervical cancer. So by vaccinating against HPV, we are decreasing our rates of cervical cancer. Another virus is herpes. So you've got your HSV1, which is your common cold sore, is what we call it, and that's mainly found on your face and lips. And then you've got your HSV2, which is the genital kind. Transmission is skin-to-skin contact with a lesion. Signs and symptoms include that blister or lesion that's painful, it's red, it's inflamed. You may also experience dysuria, so issues with urination, some flu-like symptoms, stinging or tingling to the genital area. Treatments include analgesia because it's going to be painful, salt water baths, just so that the genital area is being cleaned and it helps to dry out those blisters or lesions, and some antivirals, long-term antivirals. The big thing with viruses is that they're forever, they can't be cured. You just need to manage the symptoms at times of outbreak. Another STI that's a virus is HIV, so the human immunodeficiency virus, which later then turns into AIDS. So the The transmission is breast milk, blood to blood, pre-ejaculate, it's in semen, and it's in vaginal fluids as well. It's a latent virus, so there's a long incubation period. Signs and symptoms, often there isn't any. First contraction, sometimes patients can report flu-like symptoms, so your fevers, fatigue, night sweats. Treatment is the antiretrovirals, so antivirals again. Again, virus doesn't go away. Bacteria, whenever we see bacteria causes any kind of infection or anything, luckily we still have some antibiotics up our sleeve that the bacteria haven't mutated, so we do commonly treat with antibiotics and we're able to cure these. The issue, especially around chlamydia, is that it often doesn't have symptoms. So people can have it, carry it, pass it around, and not even realize. So transmission, it's sexually, so vaginal, oral, or anal. It's contact to contact, so direct contact. So people can also get chlamydia not just in the genitals, but in the eyes and those sorts of things as well. And you got to think chlamydia during childbirth, if the baby is born through any of these bacteria, it can colonize the child. So child eyes, mouth, ears, lungs is a big one, so they can breathe it in, and then all of a sudden they've got chlamydia as a pneumonia. Signs and symptoms, dysuria. Often they have a discharge of vaginal or penile discharges. Sometimes you can get some lesions, pain in one or both testes. Like I already mentioned, is that sometimes chlamydia doesn't actually have any symptoms. So you can live for this bacteria in your body for a long time and not even realize until later on in life you're diagnosed with pelvic inflammatory disease, which is linked to infertility, where the bacteria has caused damage to your fallopian tubes, so women's fallopian tubes, and causes scarring. Scarring, then it's like putting roadblocks in the way for the little swimmers, for the sperm to get through. So bacteria causes scarring, which just act as barricades. So the swimmers can't actually make it to the egg, so you end up with infertility. Gonorrhea, very similar to chlamydia in that it can have no symptoms and again lead to infertility. Other signs and symptoms include dysuria, testicular pain, discharge, penile discharge, epididymitis, which is inflammation to the epididymis. Again, this will cause infertility because that's the training pool for the sperm. So if the training pool for the sperm is full of obstacles, then the sperm aren't going to mature, and so when it comes to ejaculation, then they're not up to scratch. So infertility follows for women. You can get some bleeding between periods, pelvic pain, and vaginal discharge. There is sometimes some lesions as well. Transmission, exactly the same as chlamydia. It's commonly referred to as the clap. There's some theories around why gonorrhea is referred to as the clap. One of them is because of this discharge, this penile discharge, this penis discharge. Back before antibiotics, when men would get gonorrhea, the discharge was so much volume that it would actually form a crust on the tip of their penis, and they would have to literally clap on their penis to break that crust so that they could pass urine. So just a little fun fact there. Often gonorrhea and chlamydia is a combo. Have one, have the other. Syphilis is another one that was quite rare, but now seems to be making a resurgence, which is a bit scary. So this is transmission is blood or direct contact, as well as sexual transmission, so vaginal, oral, or anal. The signs and symptoms, so primary syphilis, there's a syphilitic chancre, so chancre is this one, which is like it's a small sort of pimple lesion thing that is often on the genitals. Sometimes the issue is that it's, especially on the vagina, genitals, it's female genitals on the vagina, it's quite hidden, so it's not until an examination is performed that you actually find the chancre. If this goes untreated, then it develops into secondary, where it's a systemic rash, a whole body rash, and then you can get like flu-like symptoms. These you get wart-like sores to mouth and genitals. So from one chancre to now where mouth, genitals, widespread rash, feeling like crap. And then if this goes untreated, you can get what's called a late. Then we go into a latent phase where there's nothing, and then a late phase where this bacteria actually start attacking your brain and your nerves, and it can cause issues with your heart as well. So it starts actually attacking your heart, so it spreads throughout. A lot of people back in the day, again, before antibiotics, syphilis used to cause all kinds of mental issues, psychosis and stuff, because it attacks the brain. Signs and symptoms for congenital, so women can actually pass this on to their babies. Often if a woman has syphilis, it will cause miscarriage if she is pregnant, but if not, it can actually pass across the placental membrane and affect the bubba. So they're born deaf, they have a saddle or wide set nose, and they have rash. They're born with rashes and sores on them as well. So all of these three are all bacteria caused, and they're easily treated with antibiotics. The issue is detection. Virus is a forever sentence, and it's mainly antivirals that we use just to control symptoms, and parasites is a nice little trip down to the pharmacy to get rid of your little itchy creatures. STI statistics in Australia. Chlamydia was the second most frequently reported notifiable condition in Australia in 2015 and has increased by 43% over the last 10 years. Gonorrhea, between 2006 to 2015, the rate of gonorrhea for both male and female has doubled. And in the Aboriginal and Torres Strait Islander population, gonorrhea was 10 times that in the non-Indigenous population in 2015. For syphilis, the rates among men have tripled in the last 10 years, and for women it's remained steady at 2.5 per 100,000 in the population. The rate of syphilis is 6 times higher in Aboriginal and Torres Strait Islander population, and congenital syphilis has declined over the last 10 years. The number of HIV notifications newly diagnosed in Australia has remained stable for the last 4 years. The main route of HIV transmission in Australia continues to be sexual contact between men, which account for 68% of notifications. A further 20% of cases are attributed by heterosexual sex, and 3% to injecting drug use. So why are we having more STIs? Thanks to this trio. We're traveling more. There's more testing. If there's more testing, which means that there's more diagnosing. And of course, the wonderful world of internet dating has expanded the realm of casual sex and driven up the rate of STIs.